Thank you. And honorable members, I know we haven't asked for reduction of time on this debate, but I'm just asking you humbly that if we, because there's a lot of interest, if we can speak briefly, each of us, if you agree, so that other members can be able to participate. The Honorable Junet Mohammed.
Madam Speaker, thank you for according me this opportunity. Madam Speaker, you see, they say when the only tool you have is a hammer, you think the only problem that exists is a nail. Madam Speaker, the problem in this country, and it has been so not in this regime, even in previous regimes since independence, is every problem that confronts the country, we think it requires legislation. Keep on legislating, which is good for us as parliamentarians because it keeps us busy and we do our work. But does legislation really address the issues that we are facing as this country, Madam Speaker? Madam Speaker, if you look at the issues Kenyans are facing today, are major issues of administrative in nature. Madam Speaker, Kenyans are suffering. Healthcare is a problem, and it has been so for many years. And people are going out of the country to seek healthcare, either in India or other countries. But Madam Speaker, what is the elephant in the room in the healthcare service, especially in relation to the existing institutions like NHIF? The elephant in the room is corruption. If that is sorted out, you will see every Kenyan will get quality service in the healthcare by the healthcare providers, Madam Speaker. Madam Speaker, I am not opposed to this bill at all. I'm willing to, but we must bring out and we must share as a house issues that are of concern to us in terms of what we are doing. For example, Madam Speaker, we are now saying that we want to transform the NHIF into a social health insurance. That's a good and noble act, Madam Speaker. But Madam Speaker, until we fight corruption head-on in the health sector, we will not get any value for the public money. Look at NHIF, look at MES, the medical equipment services that was done in the last regime for the counties, Madam Speaker. Those equipment have become obsolete. In fact, some of the counties, if you go today, they will not tell you whether they benefited from those equipment. They were just vendor-driven. And the majority leader can bear me witness here, whether MES, the medical equipment system, has worked. It has not worked completely. So the main problem here in this bill, the first clause should be corruption is punishable by death in the health sector. If there's a clause like that, then you'll see healthcare providers doing the right thing. Madam Speaker, if you look at NHIF, the model was borrowed from NHS, the National Health Service of UK. When you go there, they still have teething problems. They still have problems with their system, but corruption is not one of them. The quality of health care that a poor person gets is the same quality a rich man gets in the UK because of NHS. And the NHIF was supposed to be modeled with the NHS. It's supposed to work according to the way NHIF works, NHS works. Madam Speaker, until we bite the bullet and we deal with the cartels and the corruption in the health sector, I don't think, even if we bring 10 or 15 acts of parliament, nothing will change. I can promise you. So, my question is, for example, in the bill now, there are very good things that have been proposed, like the critical illness fund. That is very important. Many Kenyans are suffering. There are people who have cancer, there are people who have diabetic, and they are not getting the right attention from the healthcare providers. That is going to help. But in my view, let us not also condemn the whole institution of NHIF as it is today. It has also done some good work. So let us sieve the chaff from the wheat. In this bill, I expected a transition clause that says that the people who are working on NHIF are deemed to have, when the new institution is created, they are no longer in service, but they should be given priority in accordance with their qualification and competence. Instead of employing people from outside, 6,000 people, 10,000 people. Where are you taking these 10,000 people? They're also Kenyans. Some of them are competent people. They are diligent people. They have worked very well. They have served the institution. They have served the country. We should have a transition clause that says priority will be given to those people who are working at NHIF, who have good track record, people who have done good job, and people who have, dignity. They have no corruption cases. Everyone's file is there. The file can be perused. The other thing I don't agree with this bill, Madam Speaker, is it is proposing that the new institution will outsource claim management to 5 or so private companies. Then what's the work of this institution? If they cannot process claim, because NHIF, their biggest predicament, their biggest problem in the form of corruption was claim processing. Because hospitals were getting money that they don't deserve. Now you want to outsource to CIC, to Britam, to these insurance companies. So what is the work of the board? What is the work of the NHIF? Not NHIF. What is the work of this new institution we are creating? Then why can't you let the NHIF do it? So those ambiguities must be addressed in this bill, Madam Speaker. If we are to achieve, nobody on the floor of this House can oppose any proposal to make the healthcare of the Kenyans better. All of us have duty, we are bound to support it, Madam Speaker, because you don't know when you will become sick. You might be feeling well today, you might be the next victim. Only God knows how long will you be healthy. So we are duty bound to support any proposal that is ready to make Ishungwa stop sending other members. If you have issues, just stand up and face me. Please, I'm here, but face me. Honorable Junet, you address people through the speaker. Your point of order, Honorable Muge.
Thank you, Madam Speaker. Thank you, Madam Speaker. I am listening to the Honorable Junet, and it seems like, Madam Speaker, he has not read the